Gluteal muscle balance and bilateral strength become increasingly important after age 50 for maintaining hip stability, preventing falls, and supporting functional movement. Today we're covering 3 seated gluteal exercises specifically designed for older adults addressing muscle activation, bilateral strength, and side-to-side balance: seated hip abduction with band, seated glute bridge, hip thrust, and single-leg glute bridge. These exercises target gluteal muscles through controlled seated positions, reducing joint stress while building strength and correcting imbalances. When practiced correctly and consistently, they can help improve gluteal activation, enhance hip stability, and address muscle asymmetries. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises, especially if you have hip replacements, recent surgery, lower back problems, or balance disorders. Understanding gluteal imbalance and importance after 50. Gluteal muscles, particularly gluteus maximus and gluteus medius, are essential for hip stability, pelvic alignment, balance and fall prevention, lower back protection, and walking efficiency. After age 50, gluteal muscles commonly become inactive or develop side-to-side imbalances due to prolonged sitting, reducing activation, favoring one leg from old injuries or joint discomfort, natural muscle mass decline with aging, and insufficient targeted strengthening. Consequences of gluteal imbalance include uneven pelvic alignment affecting posture, one hip appearing or feeling lower, increased lower back and knee stress, poor walking mechanics with hip drop, and reduced balance and stability. Bilateral exercises like squats may allow stronger side to compensate, potentially maintaining or worsening imbalances. Unilateral and targeted exercises can address these asymmetries more effectively. Exercise 1, Seated Hip Abduction with Resistance Band. The first exercise is seated hip abduction with resistance band targeting gluteus medius activation. This exercise isolates and strengthens gluteus medius, the lateral hip stabilizer essential for pelvic control and balance. Here's how to perform seated hip abduction safely. Sit on sturdy chair without wheels with feet flat on floor. Position mini resistance band around thighs just above knees. Sit tall with back slightly reclined against chair back. This position optimizes gluteal engagement. Engage core, keep chest lifted. Press knees outward against band resistance, spreading legs apart. Move slowly and controlled, avoid bouncing or rocking. At widest point, hold for 1 to 2 seconds, squeezing glutes. Slowly return knees to starting position with control. That completes 1 repetition. Perform 10 to 12 repetitions initially. Progress to 15 to 20 repetitions as strength improves. Complete 2 to 3 sets. Rest between sets. Practice 3 times per week. Essential technique reminders: keep upper body stable, don't sway or use momentum. Keep feet firmly planted on floor throughout. Move slowly, emphasizing control over speed. Focus on gluteal muscle engagement during outward press. Maintain steady breathing throughout. Modifications: for imbalance correction, keep stronger leg still and press only weaker leg outward against band. Perform extra repetitions, 3 to 5 more, on weaker side. Always start with weaker side when addressing imbalance. Without resistance band, place hands on outside of knees and press outward while resisting with arms. For easier version, use lighter resistance band. What to realistically expect: with regular practice 3 times per week over 6 to 10 weeks, you may notice improved gluteus medius activation and strength, enhanced hip stability during walking and standing, better pelvic control and alignment, reduced compensatory patterns, and improved balance during single-leg activities. Gluteus medius strengthening is foundational for hip stability. Exercise 2, Seated Glute Bridge, Hip Thrust. On bench. The second exercise is seated glute bridge, also called hip thrust, building bilateral gluteal strength. This exercise targets gluteus maximus powerfully while minimizing knee and lower back stress common in standing exercises. Here's how to perform seated glute bridge safely. Sit on floor with upper back against edge of sturdy bench or couch approximately 16 inches high. Position bench so it touches just below shoulder blades, mid-scapular region. Bend knees with feet flat on ground, shoulder width apart. Position feet so knees form 90 degrees at top of movement. Tuck chin slightly looking forward, not upward. Press heels firmly into ground. Squeeze glutes and lift hips upward. Raise hips until body forms straight line from shoulders to knees. At top position, pause for 1 to 2 seconds, keeping glutes tight. Slowly lower hips back down with control. That completes 1 repetition. Perform 10 to 15 repetitions, focusing on quality. Complete 2 to 3 sets. Rest between sets. Practice 3 times per week. Critical form points: drive through heels, not toes, pressing through toes shifts work to quadriceps. Keep core engaged, preventing excessive lower back arch. Achieve full hip extension at top, feeling complete glute contraction. Maintain tucked chin throughout, don't drop head backward. Control descent, don't drop hips rapidly. Modifications: for increased intensity, add resistance band around knees, combining hip thrust with abduction. Slow movement tempo using 3 seconds up, 3 seconds down. Increase pause at top to 5 seconds for greater time under tension. Add small pulses at top of range for advanced challenge. What to realistically expect: with regular practice 3 times per week over 8 to 12 weeks, you may notice strengthened gluteus maximus bilaterally, improved posterior chain activation, enhanced hip extension power for daily activities like stair climbing and standing, better functional strength with reduced knee and back stress, and improved overall gluteal development. Seated glute bridge provides powerful gluteal training with joint protection. Exercise 3. Single leg glute bridge for imbalance correction. The third exercise is single leg glute bridge, specifically addressing gluteal imbalances. This unilateral exercise forces each side to work independently, preventing stronger side compensation, essential for correcting asymmetries. Here's how to perform single leg glute bridge safely. Lie on back with knees bent. Place both feet flat on ground, hip width apart. Position arms by sides with palms facing down. Engage core, pulling navel slightly toward spine. Extend right leg off ground, either straight or with slight knee bend. Left foot remains flat close to glutes. Keep hips level, don't allow one side to sag. Drive through heel of left grounded foot. Squeeze left glute and lift hips toward ceiling. Body should form straight line from shoulders to left knee. Pause at top for 1 to 2 seconds, squeezing glute. Slowly lower back down with control. That completes 1 repetition on left leg. Perform 6 to 10 repetitions per side initially. Progress to 12 to 15 repetitions as strength improves. Complete 2 to 3 sets per side. Practice 3 times per week. Essential safety and technique reminders: ensure hips rise evenly without one side sagging. If one side sags significantly, reduce difficulty. Lightly tap working glute with fingers during lift, improving mind-muscle connection. Keep core tight, preventing lower back arch. Move slowly with control, speed reduces effectiveness. Breathe properly: inhale before lifting, exhale at top, inhale during descent. For addressing imbalance, always start with weaker side. Perform 1 to 2 extra repetitions or entire extra set on weaker side. Monitor progress, noting when sides feel more balanced. Modifications: for beginners, keep lifted leg bent instead of straight, lift hips only few inches initially, use pillow under back for support if needed. For intermediate, add resistance band around thighs, increase repetitions on weaker side, pause longer at top, up to 5 seconds. For advanced, elevate grounded foot on low step, add light weight on hips if no back issues, use slow 3 to 5 second lowering phase. What to realistically expect: with regular practice 3 times per week over 8 to 12 weeks, you may notice improved bilateral gluteal balance between sides, better pelvic alignment and stability, reduced lower back discomfort for many, improved single leg control and balance, smoother more even walking pattern, and enhanced overall functional symmetry. Single leg training is essential for addressing imbalances that bilateral exercises may miss. Importance of addressing gluteal imbalances. Gluteal muscle imbalances are common after 50 but often overlooked. When one gluteal muscle is significantly stronger than the other, body compensates through uneven pelvic positioning affecting spine alignment, increased stress on knee and hip joints on weaker side, compensatory muscle patterns causing discomfort, and reduced overall functional capacity. Traditional bilateral exercises like squats may maintain or worsen imbalances as stronger side compensates for weaker side. Unilateral exercises force each side to work independently, revealing and addressing asymmetries. Consistent unilateral training can restore balance, improve bilateral function, and reduce compensatory patterns. Creating effective seated gluteal routine. Here's how to integrate these exercises into effective routine. Practice all 3 exercises 3 times per week on non-consecutive days. Sample routine: seated hip abduction with band, 2 to 3 sets of 10 to 20 repetitions focusing on gluteus medius activation. Rest 60 seconds between sets. Seated glute bridge on bench, 2 to 3 sets of 10 to 15 repetitions building bilateral gluteal strength. Rest 90 seconds between sets. Single leg glute bridge, 2 to 3 sets of 6 to 15 repetitions per side correcting imbalances. Perform extra repetitions on weaker side as needed. Rest between sets and sides. Complete routine takes 20 to 25 minutes. These seated exercises reduce joint stress while providing effective gluteal training. Essential safety considerations: these seated gluteal exercises require appropriate caution. Stop any exercise causing sharp pain, significant joint discomfort, excessive lower back strain, or balance problems during floor exercises. Consult healthcare provider before beginning. If you have recent hip or knee replacement, confirm exercises appropriate for your recovery stage, severe hip arthritis, acute lower back problems, or diagnosed pelvic conditions. Use sturdy furniture for seated exercises. Practice floor exercises on padded surface. Start conservatively and progress gradually. Monitor side-to-side differences without forcing rapid balance correction. Realistic expectations for gluteal balance. Gluteal strength and balance improvements occur gradually. Weeks 1 to 4, learning proper form and feeling muscle engagement, initial strength adaptations, beginning to notice imbalances. Weeks 4 to 8, improved muscle activation and control, noticeable strength gains, beginning balance improvements between sides. Weeks 8 to 12 and beyond, clear bilateral strength improvements, significantly improved balance between sides for most, enhanced functional capacity and movement quality, established sustainable routine. However, some individuals naturally have anatomical differences affecting perfect symmetry. Goal is functional balance, not necessarily perfect equality. Complementary practices: these exercises work best combined with regular walking, maintaining general fitness, adequate protein intake supporting muscle health, sufficient vitamin D supporting muscle function, proper hydration, quality sleep allowing recovery, and avoiding prolonged sitting when possible. Address multiple factors for optimal gluteal health. Monitoring progress: track both exercise performance and functional improvements. Exercise metrics: increased repetitions or resistance, reduced perceived difficulty on previously weaker side, improved form quality and control. Functional improvements: more even walking pattern without hip drop, improved balance during single leg activities, reduced lower back discomfort, easier chair rising and stair climbing, and enhanced overall movement quality. These indicators show meaningful strength and balance gains. When TO seek professional help, consult healthcare provider or physical therapist if you experience persistent hip or pelvic pain, significant imbalance that doesn't improve after 12 weeks, inability to perform exercises even with modifications, or concerns about underlying conditions. Physical therapist can provide personalized assessment of gluteal strength and balance, specific modifications for your situation, comprehensive program, and treatment for underlying issues. Conclusion: these 3 seated gluteal exercises, seated hip abduction, seated glute bridge, and single leg glute bridge, provide comprehensive approach to gluteal strengthening with specific focus on addressing imbalances common after 50. Hip abduction targets gluteus medius for lateral stability. Seated bridge builds bilateral gluteus maximus strength. Single leg bridge corrects side-to-side imbalances. Start at appropriate levels using modifications as needed. Practice 3 times weekly consistently. Pay special attention to weaker side performing extra work as needed. Progress gradually based on response. Combined with comprehensive fitness approach and healthy lifestyle, these seated exercises can improve gluteal strength, correct imbalances, and support continued hip stability and functional independence. Thank you for watching. For specific concerns about gluteal imbalances or appropriate exercises, consult physical therapist for personalized assessment. Subscribe for evidence-based information on functional fitness for older adults, practical guidance prioritizing safety while helping maintain strength and independence.